What's the meaning of artificial ventilation? Artificial ventilation. Artificial ventilation.
Artificial ventilation. Artificial ventilation. Artificial ventilation refers to the mechanical process of assisting or replacing spontaneous breathing in a patient who is not able to breathe adequately on their own. This can be achieved through the use of devices such as ventilators, which provide oxygen-enriched air to the lungs and assist with removing carbon dioxide from the body. The goal is to ensure adequate gas exchange and prevent respiratory failure. Artificial ventilation is commonly used in critical care settings for patients with conditions such as acute respiratory distress syndrome, ARDS, pneumonia, or after major surgery.